Pay close attention. The news you are about to see is fulfilling Bible prophecy.
Welcome to another edition of YPN News, bringing you news as it relates to Bible prophecy and foretold by Yeshua Hawkins, where we're going to talk a little bit about patient violence in the hospitals, COVID breakthrough cases, as we reported on before, and how that's increasing, and the market chain supply issues due to, well, basically not enough truckers to take those shipping containers to market, and that's creating kind of a bottleneck when it comes to the consumers. Well, first we're going to talk about, putting yourself in a situation where you imagine being spit on, cursed at, threatened, and sexually harassed at your place of employment. Now, imagine that place is a hospital and those doing the harassing are your patients. Well, one nurse at Cox Medical Center, Branson, described how that very thing has been occurring over the past year, and their facility has implemented a remote security system that allows workers to press a button on their person to alert security to their whereabouts.
Well, the patient safety facilitator said that because of the way the property is laid out there, that there would need to be a GPS or a wireless type system in place after seeing the number of assaults on the property, and that system was going to be quite expensive. Now, Mindy Honey with the Skaggs Foundation said that when learning that there had been 123 assaults on staff and 78 injuries, they had to move fast to fund a requested $132,000 grant. Now, she said it was a no-brainer to make that move to fund the hospital.
Yeah. Well, the patient safety facilitator said that it's not only emergency room nurses who are, of course, being assaulted, but all over the facility. And lots of times it's repeat patients. And of course, they get worse every time and they're being more violent. Well, Nurse Blevins, said that she thinks that the pandemic has made the situation worse because people have to sit in the waiting room for long periods of time because all the rooms are full and there's no place to put anyone. And this is frustrating for everyone involved, not only the patients, but the nurses as well.
Well, breakthrough infections, mRNA technology, and how is someone still spreading the virus after they are infected are just a few of the questions on people's minds regarding COVID. Dr. Frank McGeorge answered some questions from concerned citizens regarding these matters. Now, in regards to if a vaccinated young person who is socially active can transmit the virus to vaccinated older people, his answer?
Dr. McGeorge said, although vaccination is our best defense, it is not 100% perfect. And it is possible, although unlikely, for the virus to spread among vaccinated people. And that's the reason we recommend mask use for that added layer of protection. Well, another vaccinated person asked if it was possible to bring the virus from work where vaccinations aren't required to their home where an immunocompromised person resides. The doctor's answer was,
it is certainly possible. Having every employee vaccinated would be better for decreasing that chance for spread, but at least they are requiring masks and you are doing what you can to reduce your chance of being affected by being vaccinated.
Well, nearly 1 in 10 positive COVID cases have been among fully vaccinated people in the past month, along with an increase in breakthrough cases being hospitalized. In Hawaii, the numbers of COVID cases in the spring and summer seem to be decreasing, as it was in many places throughout the country. But they thought that this was taking place because vaccines suppressed the transmission. But of course, the new Delta variant, has put a halt to that. For instance, in Alaska, about 30% of breakthrough cases have been reported in July, with 20% of hospitalizations being those who were already vaccinated.
Also, 4 out of 17 who died in Alaska hospitals were breakthroughs, nearly 1/4 of the deaths. Now, as people try to get data about breakthrough cases, Hawaii is one place that's not on the list of states that the CDC is reporting breakthrough cases.
Well, what has been made known has come through occasional disclosures from health or hospital officials. Labs there in Hawaii have been reporting all positive cases to the Department of Health at least since July. And of course, when the department was pressed for data, they reported there have been 2,419 breakthrough cases as of 8/26, which is up from almost 1,900 in just the past month. Well, breakthroughs are 4% of the state's positives as of 8/26, and that's, of course, for an all-time high since they've been reporting. And 3% of vaccinated people have been hospitalized, with 8 known deaths also for those who are fully vaccinated.
Well, Dr. Lee said we need real-time data to plan forward and potentially change the strategies and approaches from a policy level and also from a healthcare perspective and planning perspective as well. Now, what we're really concerned with is, are you transmitting? And oftentimes, if you're fully vaccinated, you're not going to be transmitting if you test positive, unquote.
And that's the question that a lot of people were wondering. Can you transmit that? Which seems a little bit kind of, counteracting to what the other doctor, Dr. McGeorge, said, that, a person who is fully vaccinated could potentially pass the virus on to other vaccinated persons. So, kind of some mixed signals being given there. Well, we're going to turn it over to our field correspondent, Larry McGee, who has some more information for us regarding the fully vaccinated and the COVID cases that are on the rise, as well as what is taking place in the hospitals. They feel like they're kind of coming under siege with everything that's going on. Larry, what do you have for us?
The frustration of the public with ever-changing and conflicting instructions and data coming forth from the nation's health officials regarding the plague is starting to become increasingly evident. From teachers to restaurant workers, the attitude is just to go along to get along and to try to stay as best informed as one can. The public's ambivalence stems in large part from the information coming out of the CDC that has shifted multiple times since the emergence of the plague and has contributed to large-scale uncertainty. At present, the position of the CDC is that vaccinated citizens are prevented from carrying the virus and developing severe cases of illness in the event that they do become infected, while other organizations like the UCFS are stating that vaccination will prevent infection and transmission. Other organizations like Duke University are finding out just how unreliable that last statement is. Out of the 364 people who recently tested positive for COVID infection at their facilities, only 8 were unvaccinated. That means 356 of that number were inoculated and contracted the plague anyway, but oddly, epidemiologists say that shouldn't be any real cause for concern. They say instead the public must reframe its thinking with regard to the virus and accept that the plague is not going to go away and that it is possible for them to become sick if they are unwilling to take additional safety measures. For this reason, certain doctors are advocating for the reintroduction of mask mandates. As hospitals continue to struggle against the strain of those sick with the plague and in need of assistance, officials are now starting to toss around numbers to add an additional level of pressure to those who have chosen not to accept vaccination. A study has recently been released reportedly showing that unvaccinated individuals have cost the country billions in hospital bills. But despite the pressure, certain states like Florida are remaining strong in their position that vaccination should be optional. For YPN News, I'm Larry McGee. Good time, Jeff. Back to you.
Hospitals continuing to take the brunt from all the COVID and the breakthrough cases. It was already difficult on the staff members. Now looks like it's even going to be worse.
That's right.
Well, continuing with our coverage on these breakthrough cases, it seems like the media is sending us mixed signals when it comes to the effectiveness of the coronavirus vaccines. Numerous celebrities, athletes, and politicians report coming down with the virus and ending up hospitalized after getting their full round of shots. Now, breakthrough cases seem to be growing in numbers, but some experts say the term breakthrough indicates that vaccines don't work.
One infectious disease specialist, Dr. Monica Gandhi, is teaching the public this about vaccines. She said, quote, There is no vaccine in the world that completely protects you from every infection. Importantly, what they are supposed to do is protect us against severe disease, end quote. However, just a few months earlier this year, Dr. Gandhi was trying to reassure the public with this information, making this statement, quote, essentially, vaccines block you from getting and giving the virus, end quote. So the question is, which is it? Do vaccines protect or don't they?
Well, on top of this, there is really no way to know how many breakthrough cases there are among those who have been fully vaccinated because the CDC has stopped tracking most mild and asymptomatic cases. They do, however, watch for those who have just been hospitalized and or die from such cases. Now, just last week, the CDC reported 10,188 Americans experiencing breakthrough COVID needed hospitalization, and there were 2,524 deaths among the fully vaccinated.
Well, experts still say that is a small percentage in comparison with the 182 million Americans who are now fully vaccinated, as well as the 675,071 COVID deaths so far in the U.S. But many are still concerned about getting the virus no matter what. The vaccines might make people feel invincible, but now they're saying that isn't totally true.
Well, and with the Delta virus continuing to spread, the makers of vaccines are now pushing for booster shots, saying it could be a helpful tool. But still, other scientists like Dr. Monica Gandhi are saying these vaccines are amazingly protective against getting severe disease, landing in the hospital, and dying of COVID. So they aren't advocating a need for the booster.
Now we turn to the immigrant crisis along the southern border of Texas. While the White House publicly stated they would be sending thousands of Haitian migrants back to their homeland, U.S. officials have reported many of the migrants were being released into the United States.
Well, at last count, there were about 8,000 migrants still taking refuge under the Del Rio Bridge, waiting to be processed. Now, President Biden told the press, "We will get it under control," but Texas Governor Abbott does not think it's possible, saying they have shown no capability of being able to process all these migrants by the end of this week.
Well, thousands more migrants have already been flown back to their own countries, but not all of the president's usual allies are joyful about this, and they're actually calling for deportations to be stopped. Senator Chuck Schumer pleaded, quote, "I urge President Biden and Secretary Mayorkas to immediately put a stop to these expulsions. The horrible treatment of these innocent people who have come to the border must stop immediately," end quote.
Well, Republican Senator Ron Johnson was grilling the Secretary of Homeland Security, asking with irritation in his voice, how many people have been returned? How many people have been detained? How many people have been dispersed to all points throughout America? But when Secretary Mayorkas had no information to provide the senator, he was left still frustrated.
Gerline Joseph from the Haitian Bridge Alliance explained that the immigrants are, quote, coming to the Mexican-American border because they're in need of protection, because they are dying, because they need support, end quote.
Well, there is another crisis looming in the U.S., but it is an economic one. Now, the cost of products and services have shot up astronomically, in large part due to the bottleneck merchandise sitting in U.S. ports waiting to be delivered to the consumers. Now, one major port is along the West Coast, stretching for 47 miles from Los Angeles to Long Beach, where 40% of the country's imports are received.
Wow. Well, it's like an LA traffic jam. However, it's literally in the Pacific Ocean just off California's coast. There are now 70 cargo ships waiting to get into port, carrying everything from furniture to clothes and electronics to holiday toys. LA Port Director Eugene Soroka told CBS Evening News shipping traffic is up 50% from pre-pandemic levels, explaining it was because of the Christmas season. Well, Soroka said the American consumer's buying strength is so strong and epic that we can't absorb all this cargo into the supply chain.
Well, because of this, the average American is not going to find the products they are looking for as quickly as they would normally. Well, many recommend starting now to shop for the holidays. Some vendors, like bicycle shops, sold out of their inventories last year and are still trying to restock for this year's buying frenzy. Now, much of their merchandise is close by, sitting in shipping containers, just waiting for their turn to dock.
Bob Beisterfeld, CEO of shipping logistics company C.H. Robinson, says there are really on average of about 16 available truckload shipments for every available truck to move product out of there. The shortage of trucks and drivers to pick up products are forcing some major retailers to pay for planes to fly in goods from overseas and even chartering entire container ships. Mr. Beisterfeld continued, quote, "And that's something that frankly we've never seen before. We expect there will be more bare shelves for the holiday season this year than people may be accustomed to," end quote.
And that's a pretty, you can see it's a pretty dire strait there when they're having to pay for planes to now bring it over instead of the traditional cargo ships. So, and some of the analysts, Katana, are saying that this economic log jam is going to go into the, or continue to the end of 2022. Wow. So it's not going to be over anytime soon. Well, is war with China inevitable? The U.S., Great Britain, and Australia think so. Take a look at the summary of recent moves by the largest Asian nation and decide for yourself. Look at this video.
War with China. It sounds unthinkable, but according to many experts, the countdown may be on. China's President Xi Jinping is shaping up to the West like never before. And just last week, a major new military alliance was announced between the US, Australia and the UK to counter Chinese aggression in the Pacific.
The first major initiative of AUKUS will be to deliver a nuclear-powered submarine fleet for Australia.
America and its allies are preparing for a battle we didn't think was possible.
The idea that China would never attack, even never invade, well, I wouldn't count on that.
Xi Jinping is already on a collision course with his own people. From recently outlawing boy bands to enforcing propaganda lessons in primary schools. Xi Jinping is taking control, and he's prepared to fight for it even beyond his homeland. If this unimaginable conflict were to happen, it would begin with an invasion of Taiwan, the tiny nation off its coast that China has long believed is theirs.
Once they make the decision to do this, they will come full bore, like a crazy man with an axe.
Control of Taiwan would give China a huge new military reach over the Pacific.
That would put Australia in the firing line pretty quickly.
But is Australia putting itself in the firing line by talking too tough to China?
It is very dangerous to frame China as like worse than Darth Vader.
Tonight, we investigate just how close to war we really are.
The question of whether or not to go to war may well end up getting decided for us.
So is resistance futile?
We should not, to borrow a phrase from Game of Thrones, bend the knee to Beijing.
Well, you can definitely see the provocative actions of China, which has the other nations who are in opposition to China's moves definitely kind of on edge. And this is building up toward definitely some military actions that are going to take place in that region there, South China Sea being a part of it, but it's going to spread throughout that whole area.
Right, and if you listen to how the analysts talk, they're not, some of them are saying we're very, very close. Not like this is that far off. It's, one move or one wrong move, and it could launch us into a war. Yeah,
and we've reported in times past that war is very profitable for some people. So with the economic downturn that we're seeing, we just talked about off the Pacific, in the Pacific off the coast of California, some other industries are going to be looking to generate more income for themselves, and war is a great way to do that.
But it's a serious cost to people's life.
It sure is.
Well, if you want to find out more about these stories, contact the House of Yahweh. When you do, don't forget to request your free copy of the Prophetic Word magazine and monthly newsletter. Here's how.
To contact the House of Yahweh, you can write them at the House of Yahweh, P.O. Box 2498, Abilene, Texas 79604. You can call them at 1-800-613-9494. Visit them on any of their websites by going to Yahweh.com, YisraelHawkins.com, or Yahweh'sBranch.com. You can visit our website by going to YPNnews.com. You can email the House of Yahweh at info@yahweh.com. And for all calls outside the United States, please dial the number on your screen. And don't forget the Yisrael Says and Ask Yisrael program available to assist you in studying and understanding your scriptures. You can find those two programs free online by going to YisraelSays.com and AskYisrael.com.
Well, don't go anywhere. Up next is another enlightening message from Yisrael Hawkins. From all of us here at YPN News, I'm Jeffrey Heimerman.
And I'm Katan Alexander.
Thanks for watching.